Back here on this Saturday morning, Sports Medicine Weekly. Steve Cashel and Dr. Brian Cole. Time now for the staple of our show. It's our Ask the Doctor segment here on Sports Medicine Weekly, giving our listeners the opportunity to have Dr. Cole address their specific sports injury issues. You can get involved very easily. Go to our website on our homepage. The website is sportsmedicineweekly.com, and on the homepage, you'll see the picture of Dr. Cole and yours truly. Just click on that link, and you will be able to ask the doctor a question. Ready, Doc? Got some good ones for it today.
Yeah, I'm in. Challenge me.
All right, here's the first one. Comes from a listener. Which is better, Dr. Cole, treadmill or outdoor running?
Well, I mean, I think it's one of those things that kind of depends on your goals. They each provide different benefits. So outside running might provide more muscle activation because your feet kind of have to grab the ground around you to propel you. And in contrast, a treadmill does some of that work for you by sort of feeds the bell to you. Running outside is a little less predictable and as far as activating more muscles. I will say that, running on a stiffer surface like asphalt or concrete, that's going to provide more ground reaction forces, and that can actually give more load to your joints and your bones and so forth. So I would say if you're training for an event and you're on a treadmill, that may not mirror what that event, if you're doing a 5K or a half marathon or marathon, I think you probably have to be a little careful about doing too much treadmill running because your joints aren't used to the load. So you definitely get more load transmitted to your joints when you're outside versus on a treadmill because they're really designed to absorb like what we call ground reaction forces. So you can actually limit the amount of load to your joints, and you may not have as much post-running soreness when you're on a treadmill. I think it's a little easier to train at speed and interval training on the treadmill because you can control the environment. You can turn it up very quickly or down. You can also control the incline. So as far as like doing HIIT, high-intensity training, things of that nature, I think a treadmill gives you more variability. But, the biggest problem, Steve, is it's just so boring. It can be very boring, if you don't have TV or anything like that. I've actually started to listen to podcasts while I'm on a treadmill just to break up the monotony. But I think nothing's better than a great outdoor run for just to clear your head. But if you're really training for something, I think treadmill can really translate into significant gains for outdoor running if it's used responsibly. But I would say mixing it up is probably pretty important.
How about mixing it up underwater, Dr. Cole? I was reading a story that I believe it's in India where they now have these sports injury centers that have these
underwater treadmills that they have at the centers, actually?
Yeah, these high-altitude training hypoxic chambers, right?
Got it.
Which is interesting. I mean, so I'm picturing a treadmill underwater with head above water. Now, the Bulls have something like that at their training facility?
They do, and that's not, so when you're recovering from injury where you can't tolerate high loads, but you want to get into the running moment, so you can use a gravity-eliminating treadmill, where you basically put on this almost like this diaper that reduces, and it's in a chamber that reduces gravity, and you can do it by percentages of body weight, or you can actually do it in water, which is pretty traditional. So it's a less weighted environment, and you can control it based on how high the water is. So it's a treadmill belt, if you will, at the bottom of the pool. And then you're basically retraining on it. So we use it a lot for athletes that are recovering from lower extremity injury where we're not quite ready for them to put the full body weight, what we call that, I just commented, that joint reaction force. We're not wanting them to transmit all those loads upstream. So we reduce the load by filling a tank with water and they're running on a treadmill, but they start to get running down. It's a very good way to introduce increasingly higher impact activities. We do it after ankle sprains all the time with the Bulls and many of our other athletes.
That's really cool.
Yeah,
really
it is pretty cool.
Let's move on to question number 2 for Dr. Cole. Is exercise good for patients with osteoporosis?
This is a big one. People often think about osteoporosis as affecting only women, but it affects men too. And I think the most important take-home for those who are trying to prevent or maybe even reverse the effects of osteoporosis or thinning of the bones, if you will, is to stimulate bone formation. And the best way to stimulate bone formation is through load. So it's weight-bearing activities are what's really important to help reverse or at least minimize the decline of bone density that happens over time. So walking, stair climbing, jogging, you want some type of mechanical intensity that can increase ground reaction forces. So that's pretty important. And you want to do what you can tolerate. You don't want to get overuse injuries, but load-related activities with weight-bearing for aerobic conditioning is super important. And then strength and resistance exercises such as weights and cycling and swimming. You want to increase muscle mass. You want to increase bone marrow density. And that only happens when you stimulate various body regions. So resistance training with weights is really particularly helpful. And then, finally, sort of that what we call the multi-component exercises, where you do progressive resistance strengthening, balancing, doing things with the feet on the ground, so-called closed chain exercises, and so forth, are all really important. The bottom line is you want to load your joints in a responsible way and load your muscles because that can help stimulate bones to form, to lay down more bone formation.
And whenever I see, is exercise good for patients with anything, I'm always going to say the answer is yes, right?
Yeah, for sure. I mean, there's clearly more downside and detriment to not exercising than exercising. I hear patients all the time, I was doing great until I started exercising and I injured myself. I mean, I think,
rather than sitting on the couch?
Yeah, I mean, when you look at the things that go along with excess BMI or obesity in terms of high blood pressure, joint pain, heart disease, diabetes, sugar intolerance, there's a number of the most severe diseases that are associated secondary to obesity. So I would take the risk of injury and exercise all day long compared to the things that I might have increased risk for if I don't exercise.
All righty, great stuff. We're out of time. Many thanks to our producer this week. It's Adam Stasinski. Also help from Shane Reardon. Our coordinating producer, as always, Tracy Toro. Also want to thank David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Cashel saying so long. Thanks for listening to Sports Medicine Weekly here on The Score. Up next on The Score, early odds with Joe Ostrowski. Back with another brand new edition of Sports Medicine Weekly next Saturday, 8 a.m. Central Time, only on
670 The Score.